Welcome to the 707, a weekly half-hour program produced by KRCB, a service of NorCal Public Media. The 707 features voices and stories from your community, stories that inspire, stories that can be hard to talk about, and stories that show how we are connected to each other. The AIDS crisis in the early 1980s revealed cracks in the U.S. healthcare system and our nation's struggle to help people who were dying. In Sonoma County, less than an hour's drive north of San Francisco, a small group of people came together to offer help in 1983.
It really was at that time when so many young men and women and others were dying, but basically, at the very beginning, especially as young men, were leaving San Francisco and were coming up to the Russian River, the Guerneville area, basically to die, to live out the rest of their days, because at that time there was absolutely no cure. And it was a group of women who saw that there was a need to help these young men die with dignity. And hence, Face to Face was born then.
That's Gary Saperstein, Development Director at Face to Face, a nonprofit that was started as Sonoma County's AIDS network. Over the past 4 decades, they have provided an array of services, from AIDS testing and medication to counseling, housing services, and more. That mission continues to evolve as HIV/AIDS care has improved. People are living longer with the disease, but education, prevention, and medication are still priorities, according to Violette, the program director at Face to Face, especially as there continue to be over 200 new cases of sexually transmitted infections, or STIs, every month in Sonoma County.
2010 is when we started providing HIV testing, and we did that, and we've blossomed from there. So we did testing at that point once a week, and then we opened it up for every day that we were open, and then now we do it every day that we're open, as well as on a mobile unit, and we have pop-up testing locations that we do with our county public health. We just want folks to be aware that HIV is preventable and know about PrEP and what's available and how to get PrEP, and educate people about how to get it and how it works. I think it's really important for people to have that awareness of the pre-exposure prophylactics and how it can prevent HIV from happening.
PrEP is a medication taken daily to prevent the patient from getting HIV through sexual risk factors. There are some newer versions that are administered as a once-a-month shot. Face to Face helps people find clinics or telehealth resources to access the medication. Saperstein says the organization noticed a need in the community and uncovered an opportunity to help.
It was about 8 or 9 years ago now, I believe, that we started the first harm reduction program here in Sonoma County, which at that time was very hush-hush, underground, because this wasn't anything that anybody wanted to talk about. But it still is related to HIV, because the goal of harm reduction is really keeping people healthy. And so that program, under Lori's guiding hand, has really flourished over the course of the last 8 or 9 years now. And it has become the largest program here at Face to Face.
He says the needle exchange program is important on many levels.
We basically every year exchange around over 800,000 needles right here through our offices on 2nd Street, with approximately about 84-85% of those needles coming back to us, which is great because it's keeping them off the street, keeping people healthy, from HIV, STIs, other diseases as well.
Face-to-face care programs also address housing issues and mental health. Saperstein and Violette say the mental health program started about 6 months ago.
We live in very challenging, very stressful times, and they feel it as well, even more so. And it's great that we are able to offer that to people, and they have someone to come talk to. And we do it, is it twice a week now, Lori, or 3?
Yeah, so we offer it on Tuesdays and on Thursdays, and we do have Spanish-speaking therapists, so folks that are monolingual Spanish-speaking still have access to therapy, and it's free. And I think that's an important piece, that folks can get assistance in daily life struggles and have somebody to talk to and just have somebody to listen to them.
With this expansion of services, Saperstein says it was time to redefine the mission of Face to Face.
We just spent the last year rebranding, looking at our mission statement, our messaging, because we realized that we needed to evolve with the times. We're doing the work, but people out there didn't know about the work. we felt that it was really time that people knew what we were doing here. The bottom line is we lead with love, without judgment. Our goal is to meet people where they're at so that they can live their best life and live their life where they are now. So we meet them where they are.
One of the most striking messages shared by the organization is a focus on compassion and love.
Everything we do is laced with compassion. It has to be. If we lead with love, compassion is in there. It really is just about, like Gary said, meeting people where they are and truly being there for them and not telling people what they should do with their lives, but helping them to live the best, healthiest life that they can at the moment. And one day that may be one thing and the next day that may be something else. But we're here to accept people for who they are and without judgment and with caring and compassion and love.
Violette says they are also very intentional with the kind of language they use.
Language evolves, right? For example, when people are using drugs, sometimes people would refer to folks who are using drugs dirty and folks who are not using drugs clean. So the word dirty and clean have a negative connotation to it. We look at that, how language is used and how it's portrayed and how it's demeaning. And so instead of saying somebody who's dirty or somebody who's clean, we can say somebody who's substance free or somebody who's not substance free. That sounds so much less judgy. Folks who do have substance use, they can internalize if somebody says, oh, you're a drug addict. Right? That's all I am as a drug addict? No, I'm a parent, I'm a worker, I'm a community member. I'm so much more than a person who uses drugs. And so that's why when I say language matters, it's so important because, again, people will internalize that. And if they internalize that they're a drug addict, that's all they are. That's all they're ever going to be. And they internalize that. And so kind of branching out to saying, hey, you're so much more than that.
Language can also help break down stigmas surrounding substance use.
When I see a person who is on the street or people who may come in here or anywhere else, I always go, that person is somebody's brother, sister, mother, father. Nobody grows up wanting to be homeless on the street. Nobody. Or someone who uses drugs. Nobody grows up wanting to be that. But things happen in people's lives. Tragic things happen in people's lives that we don't know about. We don't know their story, just like they don't know our story. And that's okay. But if we can treat them with that compassion, we can treat them with an understanding. And hopefully if they want to open up to us, that's a beautiful thing. And if they want to one day say, can you find me help? I'm ready. That's fantastic. But we are just going to meet people where they are at right now. And we're going to do the work to treat people with dignity and respect because everybody deserves that.
A change in the core mission of the organization might be a reason for supporters to move on, but Saperstein says this hasn't been the case. It's
been heartwarming to see the response. We did an event launch of our new branding in October, and it really was wonderful. We had about 50 approximately supporters in the room who were hearing about this for the first time, and they were thrilled. It really touched people's hearts. That's really, I think, the biggest thing we're seeing right now is when we go out there with our new messaging, when we let people know that our new mission is now that face-to-face connects our Sonoma County community to the practical care and support that honors dignity for all. It resonates with people. When we say that we lead with love and we meet people where they're at, it touches people's hearts and minds.
Face-to-Face uses social media to get important information out to the community, but just as it's not easy to have conversations about substance use in real life, many social media companies are sensitive to content that they consider objectionable. Here's a sample from a recent Instagram post.
Do you know the signs of an opioid overdose? Here's what to look for. Unresponsiveness. Try shouting and shaking the person to wake them up. If they don't respond, perform a sternum rub by taking your knuckles and grinding them into the breastbone of the person for 5 to 10 seconds.
Natalie is our guru for our social media, and they do such an awesome job on all of those platforms and keeping their information relevant and interesting. Natalie is our guru.
YouTube just took us down.
No.
Yes, just 2 days ago, YouTube took us down because they say we violate their policies. For some reason, they think that our work is condoning drug use. And we understand that that's against their policy. We're not condoning drug use. We're condoning ways to help people who are using drugs.
Violette shows me an office that has an entire wall of boxes from floor to ceiling.
On this wall right here, there's 2,400 doses of nasal naloxone. This will last our program 2.5 to 3 months, and then I'll be ordering 2,400 more.
Visually, what does that amount of naloxone look like?
I would say floor to ceiling, 25% of a room.
It's a lot. It's a lot.
Well, the good news is that we know we try and keep track of what we put out, what comes back, and also what people tell us. We know last year we saved about approximately 3,500 lives because of the Narcan that we gave out here.
In the next segment, we'll talk about the fentanyl-related deaths of 2 Sonoma County students and the role Face-to-Face is taking to help our community heal. This is the 707 on KRCB.
KRCB is Sonoma County's NPR station. Wondering what makes us stand out? It's simple, our unwavering commitment to this community. Morning Music, hosted by Brian Griffith, sets the perfect tone for your day.
Brian here with you on Sonoma County's NPR station.
As the sun climbs high, join Doug Jane for Midday Music.
Doug Jane with you. Thanks for tuning in.
It's the soundtrack of Sonoma County. Then, stay informed with All Things Considered, featuring insightful reporting from the KRCB newsroom, ensuring you're always in the loop.
For Manzana, the company that helped keep Sebastopol's famous Gravenstein apple alive, their 103rd year in business will be their last.
Your home for the best in local news and music. Because when the community sings, we're here to listen. Your radio, your stories, your station. KRCB 104.9, Sonoma County's NPR station.
Welcome back to the 707 on KRCB. I'm talking with Lori Violette, Program Director, and Gary Saperstein, Development Director at Face-to-Face, on their expanded mission of addressing public health in Sonoma County. The opioid crisis in Sonoma County has been devastating. In February this year, 2 teens died and 2 teens were hospitalized after authorities say they took what they assumed was cocaine, but it was either fentanyl or laced with fentanyl, a strong synthetic opioid. Violette says fentanyl is not new to our community.
Fentanyl has been around for a long time, and it's not going anywhere, right? How we address and assist individuals is we provide a ton of overdose prevention education and naloxone. And we want to put in the hands of everybody in our county naloxone so that they are able and equipped to reverse an overdose if need be. It helps to save lives. We provide fentanyl test strips for people to test their substance to tell them if fentanyl is present, hand in hand with naloxone. In our community, in overdoses that have happened and continue to happen, it's really sad the amount of lives that get lost. Just the last couple of weeks, we've had some definitely young high school individuals who've lost their lives. What's so important for parents, teachers, educators in our community to know is that it's preventable. If these young folks would have had fentanyl test strips and Narcan available, they could have tested that substance and it could have told them if it was present. People who have no tolerance to opioids, when a synthetic strong opioid like fentanyl gets into the system, it really crashes down on that system because they don't have no tolerance. I just encourage parents to talk with their youth, families to talk with their loved ones. If you have somebody who is struggling with substance use, come at it in a compassionate way. Have them come see us and we can talk with them and we can provide them the tools. We can talk with you, provide you the tools that you would need. And we just want to save lives. Everybody's lives is important and we want to save lives.
We are in the middle of a public health crisis here in Sonoma County. face-to-face is on the forefront of that crisis, and we have been. But really, it's almost taking us back to our beginning. We began as a grassroots organization. We're still a grassroots organization. We are still having to, there's a lot of stigma and shame, like we were just talking about, even with the harm reduction program. There are people out there who don't believe in this kind of work. And as I said, still all that stigma and shame that's wrapped around it. There are a lot of people who don't want to talk about it, just like in the beginning of the AIDS crisis when, nobody would talk about it. Nobody didn't know how to deal with it. Our government wouldn't talk about it. So it's almost like we're back here again, being that grassroots organization, boots up on the ground doing the work.
Violette says they have been coordinating with local schools and other organizations.
We've done several trainings and educational events. We're part of the City of Santa Rosa School District and the SRPD's workshops for parents around fentanyl and gang violence and violence in general in schools. So we continue on playing a part in that. Again, I just want to reiterate that these are trainings that we have done for years. These are not new trainings. These are trainings that are happening all of the time. Yes, there has been more trainings happening at this time, and that's appropriate, and we want to play a part in that and be a part of that solution.
Face-to-Face is always innovating. They've placed kiosks around the county for needle disposal to keep syringes off the streets and disposed of properly. And there's a new method for distributing harm reduction supplies.
We also have vending machines that carry naloxone and other harm reduction supplies in them. We do have one of each at our location on 2nd Street, on 873 2nd Street. There's also a Narcan vending machine at the dorms at SRJC. There's also a vending machine at St. Vincent de Paul Commons right off of Mendocino. It's free. Anybody can access that Narcan.
Violette says there has been some pushback from the public about these kiosks and vending machines, but she sees it as a teaching moment.
We've had a lot of positive reaction from people who are utilizing it. We've definitely had folks wondering why they're available, why are they needed. And, for me, that's just a point that I get to educate somebody on why they're needed and why they should be around and try to stay away from the negative about them, because saving a life is nothing negative.
Funding for public health programs is always a struggle, according to Saperstein, and right now, things are uncertain.
A lot of our funding is state funding and local funding, but that funding comes from the federal government. So we know there are a lot of programs that they're looking at that are probably going to be slashed. Unfortunately, this administration doesn't feel that this kind of work is a good thing. We're bracing for that. We are trying to come up with fundraising ideas to reach out to our community, just again, like how we started, to reach out to people within our community to let them know that we need their assistance. We need it now more than ever because we could lose our programs, and we're not going to let that happen. That's one thing we won't ever do. If one thing that Face-to-Face is built on is that we always will say we need to do something, we'll do it, and then we'll find the money for it. Because we're going to do the work. The bottom line is we're going to do the work because we have to do the work.
In line with the organization's mission of meeting people where they are, Face-to-Face literally does that with their on-the-move van.
Our mobile unit is the first EV mobile unit in Sonoma County to do the work that we're doing, and we're really proud about that, giving back to the environment as well as being able to save our agency a little bit of money, not having to pay for gas. Yes, our mobile unit goes around to different locations throughout the week, all in Sonoma County, and it provides all the services that we could provide in our building on the van. So we can do testing on the van. We can offer services for folks that are living with HIV and needing assistance. We can provide harm reduction supplies, naloxone, fentanyl test strips. We're able to do everything we do here on that mobile unit. And on our website, it has all the locations that we're at and a mobile phone number that's associated with the van. So if a person's ever looking for where the van is, they can call that number and the van person can say, oh, we're on our way to Petaluma, or we're on our way to Guerneville.
The way the van came about was actually during COVID, because the first day we had to close our doors, and like I said, nothing will stop us. Lori said, we can't close our doors. But we were like, we have to close our doors. So Lori emptied out the trunk in her car, and she filled it up with harm reduction supplies and was literally day one, was out there on the road meeting people where they were at. We ended up giving Lori a phone, if I remember correctly. Now, it was 5 years ago that we had to close our doors during that time. Lori did not stop the work. And that's when a light bulb went off, and we said, we need a mobile van. And we fundraised for it, and it really is our community that made it happen. Here we are. It's 3 years now that we have the mobile van.
There are differing opinions on harm reduction and its role in public health. Conversations continue around how to address the opioid crisis. But Violette says there is a simple thing we can all do to improve the health of our community.
When you're out and about in the community and you see somebody sitting on the sidewalk or somebody who is sitting at a bench at a bus stop, and they may look like they're a little bit down on their luck that day, those are human beings. Those are people with lives. A smile can go a long way.
You can learn more about Face-to-Face and their expanded mission on their website, f2f.org. I'm your host and producer of this program, Michelle Marquis. Thanks for listening. Podcasts are available at krcb.org/the707. Email topic and guest suggestions to the707@krcb.org. This show is a service of NorCal Public Media. Our president and CEO is Darren Lachelle.